here's a quick overview of our health indemnity benefit insurance. This is with Southwest Senior Advisors. So to start off with, we're going to do a recap of traditional health insurance. The way that works is you're going to pay your monthly premium, and then you're going to meet your annual deductible. After you meet that deductible, you're going to have co-pays and co-insurance until you reach your out-of-pocket maximum. After that, your insurance plan is going to pay everything else. So for an example, John is a 30-year-old male non-smoker on a traditional major medical plan through the marketplace. The premium for this plan in this example is $350. There is an $8,700 yearly deductible. So after he reaches that deductible, he will then pay 40% of his healthcare costs until he reaches the max out-of-pocket of $12,500. So to sum up kind of his financial situation for his health insurance, he's going to pay $350 a month plus $8,700 for his deductible, and then the plan will start to pay a little bit. It'll pay 60%, he'll pay 40% until he reaches $12,500, after which the remainder of John's medical bills will be covered. Most people don't even reach that, so it's almost like they don't have any health insurance because they're far away from even their deductible and they're paying everything out of pocket other than some preventative care. An alternative is our health indemnity coverage. So the first kind of key point for those is they're affordable. Most of the time they're going to be at least the same amount of premium, if not cheaper, than your marketplace insurance. And you're not going to have the high deductibles and things like that. The other thing is they're customizable. So instead of just having a few choices like a high deductible and a low deductible, you can customize these plans to fit your risk assessment as well as your health and your budget and all those types of things. They also reward you. So they do take a little bit more as far as you being in charge of your health care and aware of where you're getting your care and things like that, being more of an educated consumer. And by doing that, you're going to be rewarded by having lower medical bills and such. So the way they're going to work is there's a few different options to choose from. Those are right here, and we'll get into that in a little bit. And then you can add on different riders to those. So you can get coverage to cover if you have like cancer, or if you have a heart attack, that's what a specified disease will cover. If you have an accident, we can put an accident policy on there. We can do an enhanced accident policy, and then a critical illness rider that will also cover for like cancer, heart attack, stroke, and things like that. So that's where you design that up here. This is the gold plan. So you're going to choose your calendar year maximum benefit. And then down here, you will choose the benefit level, gold value, gold plus, or gold preferred. And then you'll choose your confinement deductible. That's the only place you're going to have a deductible on this plan is if you are hospitalized. And you'll see down here that if you choose a $5,000 deductible, that they will pay you on the first hospitalization a $2,000 amount to help offset that deductible. So really your deductible is only $3,000, and that's only for your hospitalization. Everything else is going to pay right away. So for instance, on this side, we have our outpatient benefits. If you need to go to the doctor because you have an earache or something like that, and you have this preferred plan, they will pay $160 for that visit, regardless of what the visit costs. If it is less than that, a lot of doctor visits are $90, $100, things like that. You'll pocket the remaining amount of that $160. They cover for specialists, they cover for imaging, they cover for ER, they cover a lot of different things. Pretty much anything you can think of, they're going to cover, and you're going to know what it's going to cost or what they're going to pay for those different things. So we will jump here and do a quick little example for you to see what this insurance would cost for that same 30-year-old. That example we did was in Texas, so we'll do that one here as well. We're going to choose a 30-year-old. He's a male. No tobacco. So we're going to choose this gold plan. We'll do a $500,000 yearly benefit, a $5,000 deductible for the hospitalization, and then we're going to do the preferred units there with 3. I usually add on a $30,000 critical illness. That'll help with your cancer, heart attack, things like that. So right there, kind of just a base plan. We're looking at $210.46 a month. So we'll select that. And then I'm going to go ahead and add in our catastrophic accident policy. So we're going to get $500,000 benefit for that. And we will take that down $75,000 for the deductible, and that's going to be $31.32 a month. And then we're also going to do our specified disease. Same thing, we're going to do a $500,000 benefit and a deductible of $75,000. So we're at $20.28. Again, this is customizable. We can play with those numbers if you need a little bit cheaper premium. But John, that 30-year-old, he's going to be paying $262.06 a month and have phenomenal coverage that's going to start paying right off the bat as soon as he needs it.